finish off talking about some more of the practical advice and other ways to help manage osteoarthritis, primarily through weight loss, um, both through natural methods as well as using Ozempic. We're also going to talk about psychological barriers and some other community resources that might be able to help you out. Next slide. So as we mentioned before in the past webinar, weight loss is strongly recommended for osteoarthritis. One big reason is that an increase in body fat of just 6% increases the risk of osteoarthritis in women by 26% and increases the risk in men by 34%. On the other hand, losing 10 to 20% of your total body weight results in greater knee and hip joint function and decreased pain, which, as we mentioned in the past webinar, decreasing that pain and increasing function are some of the biggest goals that we have in osteoarthritis treatment. An interesting fact is that actually 1 pound of weight loss in your total body results in 4 pounds less of the load exerted on your knees during regular activities. So that's a fourfold impact on the forces on your knees. So that just goes to show how impactful it really is to lose that body weight. Because you can imagine if you lost around 5 pounds of your total weight, that's 20 pounds off of those knees with every single step. Additionally, early weight loss results in a almost 35% decrease in the risk of needing a total knee replacement in women, and almost a 37% decrease of that chance that you need replacement in men. So we have a little quote here: "The harder I work, the luckier I get." So putting in all that work into weight loss really helps with your chances in reducing the risk of severe osteoarthritis or needing something like a total knee replacement. Next slide. So one weight loss strategy that we can suggest is combining time-restricted eating, which is when you limit yourself to eating um, in a certain window of the day, for example, 8 a.m. to 4 p.m. And it doesn't have to be completely strict. You might want to eat, low-calorie foods, or you might have some things you're allowed to eat outside of that window, but primarily you're only eating in that window. Maybe outside you're only drinking water or something like that. But you can combine time-restricted eating with high-intensity functional training, or HIFT, which looks like different things depending on how you want to do it. In this study where they examined it, they did 8 sets of 8 functional Tabata exercises, and it looked like 20 to 30 seconds of doing a set with 10-second rests between each set of one exercise. And between these exercises, you would rest 2 minutes. So that's a way that you can get in that functional training, but do it at a higher intensity and allow yourself to have short rests between those sets. So combining time-restricted eating with high-intensity functional training actually showed the best results in a research study after 12 weeks of this intervention. So they showed the greatest decrease in body weight of over 11 kilograms. They also saw better decreases in their BMI, in their waist circumference, and their fat mass. Another important detail is their caloric intake went down by about 400 calories per day. And what we know is that weight loss is pretty much determined by your calories in versus your calories out. So how many calories are you eating versus how many are you burning? And the easiest way for us to influence that equation is to eat less calories. Of course, you can burn calories through exercise, but it's very, very difficult to burn off enough calories to make up for a bad diet. So you can never out-train a bad diet. Really, the best thing you can do for weight loss is reduce that calorie intake. And it showed that time-restricted eating and combining that with high-intensity functional training was an effective way to reduce that calorie intake. And it showed in the body weight results as they lost over 11 kilograms on average. So we have another webinar here that you can check out if you want to learn more about this study, learn more about the specifics of how it worked and what the findings were. Yeah, next slide. Another potentially vital piece of your weight loss journey might be a semaglutide or a GLP-1 agonist type of drug, for example, Ozempic or Wegovy or Mounjaro. So in this study, this was a very well done study, step 9 trial, 68 weeks long. It was double blinded, randomized. There was a placebo, and they studied patients in 61 different sites in 11 different countries. So a wide variety of different patients. And what they did was they compared the semaglutide at a dosage of 2.4 milligrams of a weekly injection compared to a placebo. Both groups also had counseling on physical activity and a reduced calorie diet, so they had the knowledge of the lifestyle changes that they needed to make in order to lose weight, but the only difference was the involvement of the semaglutide for one of the groups. What they found was that the mean change in body weight from baseline to week 68 was about 13.7% of their total body weight was lost in the semaglutide group, whereas the placebo group, who did not have the semaglutide, um, only lost about 3.2% of their total body weight. And this clearly had an effect on how their weight loss actually affected their osteoarthritis, because we could see that the WOMAC pain score, which we discussed in the last webinar, is a measure of how much pain they're experiencing due to their osteoarthritis condition. That WOMAC score dropped by almost 42 points for the group taking the semaglutide, whereas it only dropped around 28 points with the placebo group. So 28 points is still quite a bit. You know, lifestyle changes, exercise, diet changes still do make a difference. But clearly, there is a significant change, significant impact that can be made using that semaglutide. And weight loss is really challenging. So if that is something that you are currently struggling with, then it is worth looking into whether or not a semaglutide like Ozempic or Wegovy or Mounjaro could be a good option for you. Next slide. So anytime that any lifestyle changes or any new changes really are being implemented, there's always going to be some psychological barriers that might be holding you back. A big one in the case of osteoarthritis is the fear of pain, especially because it's those joints that you are trying to exercise that are the ones that are in pain. And if you're exercising, you might feel a little bit of soreness or fatigue in that joint, maybe a little bit of pain that could deter you from wanting to exercise. But it's important to try and learn to manage some of that fear of the pain and try to talk to your healthcare providers or other professionals to kind of gain some more confidence and feel more secure with doing this exercise. So, of course, the biggest thing you could do is talk to your healthcare provider, talk to a professional, and get their expert opinions. Um, Talk to them and make sure exercise is safe for you, you're doing it right, and really having that team to help build your confidence, like what we talked about in the first webinar. You can also focus on aquatic exercises, using that water in a pool to help reduce the load on your joints and hopefully reduce some of that pain. You can also use things like knee braces to prioritize your joint protection and keep it safe. You can also try psychological therapies like cognitive behavioral therapy, talk therapy, exposure therapy, to try and help tackle that fear of pain. And some of that can be found at this website here, Understanding the Mental Health Care Field and Coverage Options at arthritis.ca. Next slide. Another potentially very helpful resource is this online course offered by the University of Melbourne. So this is actually a free course. It's completely online and it's 1 hour a week for 4 weeks. So a total of 4 hours that you're investing into learning more about controlling your hip and knee osteoarthritis. So strategies to manage pain, including exercise, healthy weight, and pain relief. And this course, the impact of this course has actually been studied before. So there was a randomized control trial with 117 participants, which compared the effects of taking this course compared to simply reading an online pamphlet. And they looked at these effects after 5 weeks and after 13 weeks. And what it showed was just by taking this course, patients were seen to have improved exercise self-efficacy, which is your confidence in your ability to actually complete exercise and do it well and do it safely. And you also had improved osteoarthritis illness perceptions and a reduced fear of movement. So it just goes to show that getting that education, learning more about the condition and some of the treatment methods is really, really important for actually seeing these psychological effects on your confidence and your safety and how you feel about undergoing some of these lifestyle changes. Next slide. Another great community resource as well. Any other community programs, for example, the GLAD clinics. These are osteoarthritis focused clinics which help to educate on loss of function and managing symptoms. They also help you to get started with exercise. So there's different clinics in Hamilton, including the Hamilton Family Health Team at James Street Hub. McMaster Pace is considered a GLIDE clinic as well. There's also Revive Physiotherapy and Wilson Medical Center. So you can take out your phone and pull out your camera and scan this QR code to find the nearest clinic to you, and hopefully you can find some support there as well. Remember, it's specialized and focused on improving your osteoarthritis outcomes. So that's another great resource. Next. Yeah, we can also go back a little bit and just recover pace a little bit again, just because that's one of the best exercise programs really that Dr. Curnew also recommends strongly. Let's see. Okay, yeah. So the PACE is McMaster's Physical Activity Center for Excellence. So this is a building on McMaster's campus here in Hamilton. Um, Something I love from their website was this quote here. It's not always possible to add years to your life, but we make it possible to add life to your years. So at the PACE, the way it works is you essentially start off with a physiotherapy assessment. It's a one-on-one assessment. They'll take you through different movements and evaluate your strength, your ranges of motion. And using some of this information as well as other medical history, they'll design an exercise program that's specifically tailored to you. So that's one of the best things is they can really find what your weaknesses are and where you can grow, as well as incorporating your input as well, like what you want to prioritize. Some things like your schedule, how easy it is for you to make it there to pace. All of that stuff, they're going to consider you and they're going to really individualize your program to suit you. Alongside this, they also have all of this equipment and their two gyms. So they've got the main gym and the neuro gym, and they've got treadmills, leg press machines, honestly, anything you would need in terms of resistance training or cardio, they'll have it for you. And every time you're going to exercise, you're going to be supervised as well. So registered kinesiologists are always around. There's also lots and lots of student volunteers to help you out. So that's another big aspect of, that psychological barrier, knowing that there's people around you to help you if you are experiencing any pain or any symptoms. There's people you can talk to. You're not alone at all. And if anything happens to you, there's people there that can help you. So that big community aspect of it is super important in pace, not just for those psychological barriers, but also forming those strong lifelong friendships. There's lots of people at Pace who have found lifelong friends that they almost consider family, and it's a really, really strong community. So definitely something to check out. Specifically, there's the Max Seniors program that they have for anyone above 55, and there's also the Mac Cardiac Rehabilitation Program for uh, patients who have had cardiac events or who just have risk factors for heart disease. So one thing to know about Mac Cardiac is that you will need a physician referral from Dr. Curnew. Um, Whereas for Mac Seniors, I'm not 100% sure if you need a referral or not. There's also a wait list, so it will take some time potentially to actually get in and become a member. And I think that also just goes to show how valuable this program is, given that so many people want to be a part of it. So definitely something to check out. In terms of cost, physiotherapy assessment, the initial assessment costs around, or it costs $160. And then after that, membership to this gym, to this community, costs around $50 per month. And if you do want to drive and park, there's a $20 per month parking fee. So compared to some of the other resources, it's a bit pricier, but of course, this is a very, very valuable investment into your health. So definitely something worth checking out. And if it's financially feasible, we always, always recommend something like this. Next. Yep. So kind of a good way to conclude and kind of remind us about all the different things we've talked about in this webinar and the last one is to really go back to looking at those barriers that really are going to block our entry to exercise and these healthy lifestyle changes. So one big one is time. Everyone's always wishing they had more time in their day. So if you feel like time is a big barrier for you, we do have a couple potential solutions. So one of them is to plan ahead with a calendar, really looking at your week ahead, seeing where your commitments are and where you can maybe fit in a short exercise bout, where you can fit that in between meetings or between, seeing family or friends and just trying to plan ahead. You can also try exercise snacks, which are shorter 10-minute bouts that you kind of scatter throughout the day. And that can allow you to get your exercise in without having a huge chunk of time that you need to block out. So that strategy of using these exercise snacks has been shown in research to have a positive effect and actually make an impact, despite being such a short bout of exercise. It also helps doing things like high intensity interval training or anything that's high intensity because you get to challenge your body uh, in a shorter amount of time compared to something like walking where you might not feel tired unless you do it for a long period of time. So another barrier to address, of course, is money. It's a huge, huge barrier. Money not just for that program, but also potentially paying for transportation. So ways we can approach the barrier of money is to try and save money wherever we can in terms of trying to exercise. So if you can join a free exercise program, that would be great for saving some money. We gave some recommendations in the past webinar, part one of the exercise and osteoarthritis webinar. And you can also just try some of the home exercises we also recommended in part one. These are exercises that don't really require any special equipment, maybe just a chair, maybe some things you can find around the house. And so these are things that you can do at home without spending any money at all. And you can do it safely if you do it slowly and really listen to your body. But of course, ideally, you would have a professional, but money is always a barrier. We don't want that to be something that really stops you from exercising. So try your best to work around that with some of these potential solutions. Another big barrier, as we just talked about, was a lack of confidence or a fear of pain or a fear of failure. So working with a professional is a huge, huge thing you can do to get their opinion, know that they believe in you, know that they have confidence in you, and that it's safe for you to be doing some exercise. They might also encourage you to exercise with friends or with family to sort of give each other that moral support, give each other that confidence boost, and also help with some accountability. I think one of the biggest, most difficult things when it comes to exercise is believing that you can actually stick with it, make that change, and become a better person. But having the support of your friends and your family can really make a big difference in that self-efficacy of knowing you can stick with it. The other thing about your lack of confidence, especially if you're new or have no experience with things like resistance training, is to make sure you're just starting low and going slow. So you want to start with low weights, low intensity, so you can learn the movements. You can learn how to tolerate the exercise, getting tired, challenging yourself, and really start low and just progress slowly. And you have to be a little bit patient, but with time, and with a little bit of time and effort, you can definitely make significant progress especially in the early phases. So it's always a good idea to listen to your body, do whatever you feel confident in, but slowly, slowly try to challenge yourself a little bit in that way. We can also talk about a lack of equipment. This kind of goes hand in hand with the lack of money. If you don't have anything around your house or anything that you can use to exercise, you can do some body weight exercises. Some of the ones that we recommended in part one are body weight exercises, or simply use things like the wall or some friction with the ground to provide some resistance for you. You can also, again, just try joining a free exercise program where they provide any of that equipment that you need. So if money is a barrier, if you don't have equipment, then you can also try that as well. And just a final quote here is that perfection is the enemy of progress. So, you're not going to be perfect starting out. Things are going to be challenging. You might miss some days here and there, but it's really important that you just kind of stick with it and do your best to do what you can and take it slow. Don't be too hard on yourself to try and make some of these changes. But yeah, so that's that's all from us from this webinar. Thank you for tuning in. Thank you for listening, and we hope that you can take away some very valuable information, some good resources, and some ways that you can actually implement some of these changes despite, countless different barriers you might come across. And it would be great if you could check out some of these other sources, learn more, a little bit more. We mentioned in part one that you can look at this webinar called the FIT Principles to learn about creating your own exercise program. Those guidelines in the FIT Principles video are essentially the same thing as the osteoarthritis guidelines. You can also look at some more resistance exercises on Dr. Curnew's YouTube channel, some follow along videos that really show you how to do the exercise. And these exercises also don't require any special equipment of any sort, just water bottles, chairs in that video that we've got here. And lastly, other YouTube channels are also great sources for information. So you can look at this one here, but Talking with Docs, a little bit more information about knee arthritis, and trying to treat that without having to go to surgery. So part one of the webinar also, if you want to check that out, there's lots of other great information there. That's going to be linked in the description of this video as well as in the comment section. So yeah, hopefully you learned something and hopefully you can apply some of this into your own lives.